John Popovich here again in front of the living wall with another Legends interview, and it's a great pleasure to be able to spotlight our nursing program. You know, the heart and soul of any hospital is the nursing staff, and that is really significantly playing out at Henry Ford Hospital. We're here today with Gwen Gnam and Madelyn Torakis. So the real question, Gwen, is what is the Magnet program?
So the Magnet program is sponsored by the American Nurses Credentialing Center, and it is really an award that's given to the top hospitals in the country who have exemplary nursing practice.
So, Madelyn, how hard is it to get Magnet status? Is this something you just put an application in and expect to get something back in the mail in 30 days?
I wish it were that easy. It really isn't, though, because only about 7% of hospitals across the country, at this moment in time, less than 500 hospitals have this designation. So it's not easy to obtain. We've been working on it for several years because we need to make sure that everything that we do in nursing is at an elevated level so that we influence the practice of nursing and how it affects patient outcomes. And so in order to do that, you have to sometimes relook at the programs that you have in place and what you need to do in order to get to that point. So it's a journey. It is definitely, we've been on the journey for a few years now.
What's the academic component of the Magnet application?
So there are a number of requirements, or what they call sources of evidence, that they ask us to address in that application and those documents. And they vary from how your leaders function, the structures that you have in place for your hospital that allow your nurses to return back to school, for example, to obtain higher degrees, for obtaining national professional certifications. And they expect that Magnet hospitals have those things in place. They look at what they consider exemplary professional practice. What are the things that nurses do that they excel in? The autonomy, that the professionalism, the quality and safety that they perform at. And they also want to look at what kind of new knowledge, innovations, and improvements do you have in place that take research, nursing research, and evidence-based practice and apply it at the bedside.
So you've been working on this for several years, and so what's the timetable in terms of the review process, and as well as how you would hopefully eventually, and I'm absolutely sure you will, receiving Magnet status?
So in February of 2019, we submit our documents, and the documents are pretty comprehensive. That's what Madelyn spoke of, the sources of evidence. It's our stories of how Henry Ford Hospital fulfills each one of those requirements. And it has to be prevalent on every single unit and every department that's on the journey for Magnet status. So we'll submit those documents. That takes 3 or 4 months for them to review those, go through those. They may ask for additional clarifications, more information. And then if our documents are considered to be satisfactory and they've truly shown that we're a Magnet institution, then they will request a visit with us. We'll have several surveyors that will be here for probably 3 or 4 days in our organization, and they'll come take a look at us, and they'll want to see that we're truly what we say we are on paper. Then once they have come for their visit, they'll prepare a report. It's submitted to the Magnet Council. It'll be reviewed, and they'll make a final determination hopefully by the end of 2019, and we hope to be having a big celebration in December that we have received the Magnet designation here at Henry Ford Hospital.
So let me ask both of you, what does this personally mean to you?
Well, this has been a goal of mine for my entire career. I feel like Henry Ford Hospital is a Magnet hospital. We have exceptional nurses here at this hospital. And I think this is going to be a pinnacle of my career, not for me personally, but for my team, because I think that this will recognize our nurses for the excellent care that they provide each and every day to our patients.
And I have to echo what Gwen said, because it's really a sense of pride. I think the nurses here are phenomenal. We hear so many stories about the care that they provide. It really is a Magnet facility already. It might not be it on paper yet, but we already are a Magnet facility, and really what kudos. You know, these are amazing nurses that do wonderful things for patients and families every single day, and they deserve that recognition.
Well, I want to thank both of you for taking us at least on some of the journey that you've already been on, and really look forward to the fruits of your labors. Thank you.
And thank you, John, for all your support. You and Ronnie both have made this possible.
Thank you.
Thank you very much.